So the question is whether this DNA contamination that got into our cells is going to affect our own DNA. So we've got the DNA contamination that's in the vaccines that's not supposed to be there, but is there. That David Speaker has showed is there. So there's the DNA contamination, theoretical cancer risk from that. What's the actual risk is harder to tell.
So can you tell people about cancer and the evidence that it's that the COVID-19 vaccine is causing a spike in cancers?
Yeah, this is one where there's genuinely a lot of unknowns at the moment. What we should do with a medical intervention is wait 5 or 6 years by giving it to a very small amount of people and then seeing what happens. The idea that this was given to, was it several billion people, without long-term studies is still, looking back, I still can't work out how people could have done that. How could you launch such a massive scale experiment using an experimental technology on the human race? The arrogance of it when you think back is just completely befuddling that we could do that. But the thing about cancer is there's plausible mechanisms. So just give one example. David Speaker, the Canadian virologist that I've interviewed a few times, he's identified DNA contamination. So there's supposed to be RNA, but there's DNA contamination. And if the DNA gets into the cell, it can go into the nucleus of the cell. And if it changes the DNA in your cell, then that is by definition a mutation. And cancer starts as a mutation because a mutation is defined as an alteration to the genetic material of a cell. And if that happens, there's mutations and there's potential for cancers there. That is conceivable.
So you're saying you're saying that the mRNA vaccine, the RNA in that vaccine, can get into your cell and mutate your DNA? Is that what you're saying?
No. There's two things. So the RNA vaccines we now know contain DNA contamination. It's not supposed to be there.
Oh, they're actually in the vaccine.
Yep. It's not supposed to be there. So the initial vaccines, I talked to a guy called Josh Getsko about this in Israel, professor in Israel, and he said it's a bait and switch. So during the trials, they used a particular form of, for nearly all the vaccines that were used in the trial, they used a particular form of manufacturing process for the RNA. It was based on a PCR. I'm not a technologist, but it was based on a PCR type thing. So they produced pretty pure RNA. So most of the data in the trials was done by injecting fairly pure RNA for the lipid nanoparticles. But then when they wanted to scale it up, they used bacteria to brew up essentially the viruses in. And the genetic information for the RNA, the genetic information for to produce the spike protein. And some DNA was left in. So the question is whether this DNA contamination that got into our cells is going to affect our own DNA. So we've got the DNA contamination that's in the vaccines that's not supposed to be there, but is there. That David Speaker has showed is there. So there's the DNA contamination, theoretical cancer risk from that. What's the actual risk is harder to tell. But it's kind of a plausible mechanism. So as well as that, there's the RNA. As well as that. So there's RNA in the cell. What's supposed to happen is the DNA goes from the nucleus of the cell to the RNA in the cytoplasm to make the protein. It's called DNA makes RNA makes protein. But we now know that in some circumstances, RNA can be transferred back into DNA, process called reverse transcription. And the degree to which that's happening, we don't know. It may be happening, it may not. But I've talked to quite a few scientists who consider it to be a very plausible mechanism. So you've got two potential ways there to mess up your own DNA. Potentially from outside DNA as contamination, potentially from RNA via this potential reverse transcriptase mechanism. And again, we need studies into that to find out if that's actually going on. But the main reason I'd be worried about cancer is the immune perturbance. So you're perturbing the immune system. And as we said before, the reason we don't get cancer is because we've got effective immune systems, because we're all getting cancer all of the time. And talking to some doctors and oncologists, they were seeing in their patients that patients that were vaccinated, whose cancer was in remission, were sometimes getting the cancers reactivated. So Professor Dalgleish warned us about this years ago. Patients he kept stable with melanoma for, amazing, he kept patients stable for like 5, 10, 15 years with melanoma. And yet they were getting recurrences after the vaccine. So there's plausible mechanisms. There does seem to be more cancers. There seems to be more cancers in young people. The data's hard to get. Some of the cancers that young people are getting, you wouldn't normally expect young people to get. Some of those cancers seem to develop very, very quickly, so-called turbo cancers. More cancers, especially in young people, are often presenting at a later stage 4, where it's already progressed around the body, to all parts of the body, a process called metastasis. So we're getting this. The data's hard to get, but we've got data from Italy, from one area in Italy where they're able to compare vaccinated with unvaccinated people. And they showed an excess in cancers of some types of cancers in vaccinated people. A bigger study from, I did it just last week. I think was it Japan?
Yeah, Japan.
Where Japan, yeah, data was released from Japan, and again, it seems to show this for some cancers.
Some cancers, meaning breast cancer, prostate cancer.
Yeah, prostate was probably a big one.
Yeah,
particularly in older people. Breast, I think colon was one.
Yes,
I think bladder one as well.
Yes,
there was quite a few different cancers that showed an excess. Yeah, there was about half a dozen with an increase. But the problem is, in the UK, even if we get the accurate data on cancers, which isn't readily available but could be got, how do we compare that with the vaccinated versus the unvaccinated? Because that data is not released. So what we need to do is release the data for vaccinated versus unvaccinated, the number of vaccines that people have had. Then that can be compared to the incidence of new cancers. So even if we know the incidence of new cancers, the amount of new cancers, we don't know whether they're occurring more in vaccinated or unvaccinated because we don't have the data released for who's vaccinated and who's not vaccinated. Now, the reason the government and the authorities give for not releasing this is confidentiality, which might sound valid, but of course, confidentiality covers a multitude of sins. Now, I've talked to, there's a British parliamentarian and former science minister called David Davis, who I've interviewed a couple of times. We had a campaign to try and promote vitamin D during the pandemic. And he was science minister in the United Kingdom, and he assures me that there are ways to do this anonymously. So this could be done anonymously, but as far as I know, currently it's not. Therefore, we can't even ask the question. So, because we don't know who was vaccinated and who wasn't on an epidemiological scale.
And that's to me, that's on purpose, that they don't want us to be able to do these studies, and they don't want us to go.
I know scientists and statisticians who are just waiting for this data to be released, and they'll move. But at the moment, we don't have the data we would like, which it really is a pity. Why aren't scientists chomping at the bit to get this data? It's such an obvious variable that should be considered, and yet we seem to have global curiosity deficit disorder in many of our medical and scientific classes.
October 19th, we'll be in Irvine, California. We'll be in Australia. Then we'll be in Burbank, California, the day after Thanksgiving. And then Pottstown, Pennsylvania, December 6th. Go to jimmydore.com for a link for tickets.